I'm Shirley Leung. Welcome to Say More. It's a uniquely challenging time for our nation's medical community. The Trump administration has set its sights on slashing federal funding for healthcare and research by tens of billions of dollars, which could be catastrophic for the NIH and CDC. Funding is tenuous, to say the least. Then there's mounting political pressure to restrict access to care for low-income families on Medicaid, plus care for at-risk health groups like transgender Americans and immigrants. So how are healthcare leaders navigating these uncertain times? Today, we're bringing you a live episode recorded at the Boston Globe's Health Equity Summit. It was held in May at Cambridge's Sanofi headquarters. It's a conversation with Dr. Kevin Churchwell, CEO of Boston Children's Hospital. We discuss how major changes at the federal level are impacting healthcare workers and patient care in Boston and beyond. Okay, here's the show. Dr. Churchwell, thank you for being on Say More.
It's a pleasure to be here.
So, Dr. Churchwell, can you tell me about that moment when you realized your year wouldn't go as planned?
I think it's been my decade. Usually that moment happens on a Friday or about 4:00.
That's right.
Where there's an announcement that of reducing the indirect rate, facilities administrative rate for NIH funding to 15%. And you can imagine the amount of angst and just a bit of panic that occurred when that was announced. And what we really tried to do was to, and I tell my team, my phrase is panic is for wimps.
Panic is for wimps, all right.
Pediatric critical care. In that you just can't panic in an environment like that. And so taking that as what our mantra, we basically then said, okay, what's the next step? What is going to happen? What does this really mean? And it took a period of time. It takes that weekend to understand it and understand what will be the next step in terms of things go to court, things get stopped. And then how do we deal with that moving forward is what happened during that time.
So when you heard about this 15%, how much funding is at risk then at Boston Children's?
So the first calculations for us would be each year we would lose about $80 million.
Wow.
And as you can imagine, you just can't find that on the street. And that would change just existentially what we would do, what we can do in research, if that would go through from that standpoint.
Can you talk about specific projects that won't get done if these cuts stick?
Well, it's just not the projects that are happening now, but the new projects or the new opportunities that are just being held up right now. You know, research is not just about the present, it's about the future. And what we do at Boston Children's is continue to support that present and future by finding and supporting the next investigators that have great ideas, that are looking at particular mechanisms of how cells work, diseases, and et cetera. And what that funding does is support those individuals to start that work that ultimately leads to treatments and cures. Ultimately leads to what we were talking about outside in terms of what's happening with the care of the individual with cystic fibrosis or the care of the individual with sickle cell disease. But go ahead.
I was going to, can you talk about, just in your career, the progress is made in terms of treating cystic fibrosis, and if you could explain what the disease does and how it affects children.
Absolutely. Cystic fibrosis is a problem in how cells really process sodium and potassium electrolytes. That leads to a problem in how your lung clears mucus where it doesn't. As an example, it also leads to how the pancreas works and et cetera. It's a disease that for a long period of time had a mortality. And what I mean by that is that the kids who had the disease, knew that at some point in their life, they were going to die prematurely. And so they really developed their life based upon that. For a period of time, you would die in adolescence. We got better in terms of the treatment, and they would sort of then have a life in their 20s and their 30s. But still, they knew that at some point their life was going to stop.
It was a hard life too, right?
Tough life. Every 2 weeks, every 4 weeks, back in the hospital. But the research that occurred, first understanding the fundamental mechanisms of how cells work, ion transport, understanding the genetic defect in the disease, and then ask the question, can we actually affect that defect? You were talking 30 years of work, 20 to 30 years of work, which ultimately led to the development of drugs. There's a 3-drug cocktail that 90% of the kids with cystic fibrosis have this particular genetic issue with cystic fibrosis can take that has totally changed their life. It's phenomenal what we've seen. And it's due to that discovery that's occurred.
And a lot of it was federal funding, right?
The START federal funding plus foundation funding. Joe O'Donnell's work with the cystic fibrosis locally here. It's just incredible work. A lot of dollars that's needed to really fund that sort of understanding the mechanisms and then the drug development. But that happened. And that was the relationship that we've had this partnership with the federal government for 80 years that has led to incredible discoveries across the board, medicine, all parts of science.
I mean, you mentioned earlier that federal dollars support research, support the future, right? So when those dollars are cut, what are you most worried about? What won't get done?
I'm worried about who we will not be able to support, who has these individuals who have these great ideas. And I'm worried about how they will decide, I don't think I'll go into medicine or biological research. I think I'll be a computer science, right? Because that's where the money is. These are brilliant individuals. They could probably do anything they want in life. These individuals, if we can supporting them, it changes the world, changes individuals, changes our children, gives them a real future. And that's what I worry about. And then are we going to be able to support them in that work?
I want to ask about a specific Boston Children's program. It's the first pediatric and adolescent transgender health program in the country. President Trump, through a series of executive orders, has stripped away many rights of trans and non-binary individuals, including defunding gender-affirming care for youth. I mean, even before Trump was elected, there were some questions about paying for this type of care. And now he's really doubled down, with threats of withholding federal funds and other penalties. So do these headwinds make Children's rethink how you provide care to these patients?
They've not created an environment where we are rethinking. We are totally committed to the care of all of our kids. And the goal of Boston Children's Hospital, the goal of any pediatric hospital, especially Boston Children's Hospital, is to work to create the best future for that child. So our gender affirming care program is a great example of that, in that the important part that I would get stressed to everyone is that these kids have a real issue that they're grappling with that is affecting their life from a medical, from a physical and mental standpoint. And our ability to intercede and support them has been transformative for that child, for that adolescent, for that young adult, that they can see a future for themselves. And so our commitment to that is straightforward, has not wavered. And we have committed our support to our gender affirming care program in that regard. I will tell you that our state leaders have been incredibly supportive. Our governor has been incredibly supportive. Our attorney general has been incredibly supportive of the work that we're doing, because it's work that really supports that individual child, that family. And so we continue that work. We know that there are headwinds, right? And we've seen this across the country. Little known fact is that we see a lot of kids, families from other states now, because they can't get care in their state. So they're coming to us in that regard. And there are going to be challenges moving forward. We're trying to be very smart about it. we're working to make sure we're supporting our caregivers in that regard in the care and the work that they're doing.
No, but what about, do you depend on any federal funding or government funding for this type of care? I mean, what do you do if that funding disappears?
Right now, the support of the care of those kids really comes from either commercial insurance or Medicaid.
Mm-hmm.
And that's where the rubber may meet the road there in terms of decisions made about Medicaid funding or how the commercial payers decide about that support.
As a Black doctor and now hospital CEO, you've long championed health equity. If DEI programs are to be rolled back, do you think they will be hard to re-implement?
That's an important question. I don't see, I've never seen DEI as some separate thing. It's a separate program that sort of sits out there, as opposed to integrated in what we do every day. And that's always been my goal. And that's what I've always tried to help lead in terms of what we've put in place. And so given that, we will continue to do the work that we have done in terms of providing an environment that every child gets the best opportunity for care that they can receive at our hospital. Part of that is the work that we've done in diversity, equity, and inclusion. And you can call it another name, you can, whatever you want to call it, but it's integrated in what we do. And it's for every child. And to me, the discussion kind of gets lost when the discussion tries to pit it as something that's different or wrong or et cetera, as opposed to, no, it's the ability for us as a society, us as a children's hospital to provide the best care, the most optimal care for every child that we see. And we integrate that in terms of what we do. Now, what does that mean in sort of reality terms? Well, we think about and we work to try to understand where the child and the family are coming from. And in doing that, we're better able to actually provide care for the child, who they interact with, how the interaction occurs, how we're viewed from their standpoint. You know, if you walk into our children's hospital and you stand in the lobby, it's always a great thing. I always encourage everybody to do that, because what you'll see is the United Nations, and you'll see everybody from all parts of Boston, New England region, et cetera, et cetera.
And all over the world.
And all over the world. And so the question is, given that, how can we best provide the most excellent care if we don't reflect who they are? And we're able to pull from the entire range of talent that's out there. And so that's what we're trying to do, and that's how we've integrated it into what we do. And so that's how I view it. If I get asked anywhere else, that's what I'm going to say, and that's what we'll continue to do as we move forward.
So in higher education, we're seeing some presidents, like at Harvard and Princeton, they're standing up to the Trump administration, over proposed funding cuts. Do you see hospital CEOs doing the same thing?
Yes, I'll say that quickly, and that we believe in what we are doing and the importance of it. The issues that our colleagues are facing, our brethren are facing in the university setting, those issues are profoundly important. And what Harvard has done is so important. And it is going to be that question that has to be answered in terms of the ability for universities to teach and to educate in a way that is across the spectrum. It's never been the question for me, who's right and who's wrong, that you shouldn't talk or they shouldn't talk. Everyone should be able to talk, of course, and present views and have the discussion, because that's how we learn. That's how we are able to move things forward. And to preserve that ability for our universities to do that, I think is profoundly important.
I mean, At Children's, I mean, you work, I mean, we think of you as seeing patients, the clinical side, but you also do a lot of research. So your fates, and often you work with the universities, right, too, and and your fates are kind of tied together. So I was just wondering if you could talk about, I mean, when we read about what's happening at Harvard or MIT, I mean, there are layoffs, they're pausing research, there's a hiring freeze. I mean, what is happening at Children's Hospital? Have you had to do any of that?
What we've done is take a very measured approach around what's happening. Uh, we have paused the major, what we call our capital projects. These are capital projects that run into the 500 million range, or et cetera, because they are associated with our what we call our planning exercise, a 10-year capital plan, assumptions that we've made that have been very consistent about where dollars would come from the federal government and et cetera, so that can move forward. And so what has been created is an incredible instability. You can't plan right now. I've told our folks, our board, is that I think the next 6 to 8 months will clear that fog. We call it a fog in terms of what are the rules of the road here. And given that, we will then figure out how we can move forward. But right now, we've paused those major things. We've paused any major recruitments and et cetera. We've also really maintained that those that are part of Boston Children's Hospital, we are supporting, especially our research community. How do we bridge them as we get through this fog that we're dealing with right now?
When we were talking earlier, you said, I think you have about 15,000 employees, right, at Children's. It's quite a big enterprise between clinical and research. So anxiety must be really high among your employees right now.
Yes.
How do you talk to them? What do you say to them during these uncertain times?
Well, we talk a lot. And we try to do it in multiple forums to try to answer their questions. We've tried to be very transparent. My usual, every third question is, I don't know. I can't give you an answer. But that's okay. It's more that the ability for them to ask the question and to actually know that we're thinking about it. And then our promise to them is that we will continue to follow up and continue to have that dialogue. And so we are doing that on a regular basis in as many forms as we can, email, town halls, Zoom, and et cetera, to try to keep everybody up to date and try to let everyone know where we are, what's going on as we go through this.
I mean, is it like another pandemic for you?
It's like the pandemic. It's almost like Groundhog Day. I thought I was going to.
I know the feeling.
Thought I was not going to hear Sonny and Cher, but I keep hearing Sonny and Cher.
So this has been a heavy conversation. It's been kind of like this all day long at this Health Equity Summit. So I was just wondering, in light of everything that is going on, what gives you hope during this time?
Let's all remember the arc of justice. And let's remember that we live in a country that has a phenomenal history, but an important history. It's never been just roses and carnations. The work to continue to move forward has been important work, difficult work, but work that we all are committed to continue to move us forward as a country. My mom was born in 1931. My dad was born in 1917. So my dad went through 2 world wars. And I will tell you, he was born at the end of World War I. He went through World War II, and I tell you, he didn't volunteer. And he then started his work as a newspaperman at a daily Southern newspaper.
I didn't know that.
Absolutely.
You buried the lead.
I buried the lead. He's actually in the Smithsonian.
Oh, wow.
Yes. And so looking back on their life and what they went through, I missed it. Okay. I missed it by just a few years in terms of colored bathrooms. Now, I have brothers that are 8 years older than I am, and they went through it. And so just to appreciate the arc of our country It's never been easy. It's been hard, but you keep moving forward. And I think that we have to continue to keep moving forward in this piece of work.
Dr. Churchwell is the CEO of Boston Children's Hospital. Thanks for joining us on Say More.
Thank you.
Say More is a production of the Boston Globe. Our producer is Caitlin Harrop, and our sound engineer is Uzair Ahmed. Jim Dow is our editor. You can reach us at saymore@globe.com. And if you like the show, please subscribe and leave us a review wherever you get your podcasts. I'm Shirley Leung. Thanks for listening.